I am Dr. Murali Krishna, CHV, Senior Consultant Neurophysician, Care Hospital, Malakpet. Today we are going to discuss about brain stroke. Everybody knows about the heart stroke, but only few people know about the brain stroke. Brain stroke is the second most common cause of death after coronary artery disease, means heart diseases. And every year more than 10% of people are every year adding to the stroke percentage of patients. So we should know about the brain stroke, and it is a treatable condition. So by definition, what is meant by stroke? So anything sudden occurrence within the brain vasculature, whether it is going to be blood vessel either ruptured or blocked to a particular area of the brain, then it causes a brain stroke. So by mechanisms, brain stroke is of two types. One is ischemic stroke, another one is hemorrhagic stroke. What is meant by ischemic stroke? So here the blood vessel supplying to a particular part of the brain is blocked from a blood clot, and this blood clot from either from the heart or from the neck vessels or directly within the blood vessels by excessive fat deposition or atherosclerosis. So then what is meant by hemorrhagic stroke? Hemorrhagic stroke is the condition wherein the blood vessel ruptures within the brain tissue, causing a bleed into the brain. And there are one more condition called subarachnoid hemorrhage, where the bleeding occurs in between the brain tissues into the subarachnoid spaces by the rupture of the aneurysms. Aneurysms are the small balloon-like projections from the blood vessels. So far we know what is meant by brain stroke. So then what are the types of the brain stroke? So then what are the causes of the brain stroke? The brain stroke can occur at any age group. It can occur from childhood to infancy, childhood to up to the old age. Depending upon the age group, there are certain specific causes are there. Now within the children, any head injuries or brain infections or any conditions of the heart that will be predisposed to the brain stroke in the children. Then brain infections can cause brain stroke in the children. And into the adulthood or into the adult age group, the major risk factors are the smoking, alcohol, hypertension, diabetes, high cholesterol in the blood, excessive stress, and these are the risk factors for the brain stroke. And then for hemorrhagic strokes, alcohol, kidney disease, and road traffic accident, they can predispose to the hemorrhagic strokes in the adult group. And in the old age group, they can have brain stroke major of vascular etiology because of hypertension, diabetes, smoking, alcohol. So these are the causes for the brain stroke in adults. Then so far we know what are the causes of the brain stroke and what are the risk factors for the brain stroke. Then we will know what are the symptoms of the brain stroke. So World Federation produced one acronym called FAST, means F-A-S-T, for brain stroke, for faster identification and early recognition and treatment for the brain stroke. What is meant by F? F stands for facial weakness. So either the weakness with a deviation of angle of mouth to one side, the drooping of eyelid, or sudden numbness in one half of the face. These are the symptoms of the face pertaining to the stroke. Second one is arm. A means arm. Arm means arm drift, means weakness of the arm, unable to lift the arm up or unable to hold the things with the arm, or sudden numbness in one side of the body including the arm and leg. So these are the symptoms pertaining to the arm. Then S stands for speech. Speech disturbances, sudden loss of speech or sudden difficulty in speech. These are the causes of the speech. Then T stands for time. Why should we care about the time? Because every minute most of the neurons will die because of stroke. So to prevent that in ischemic stroke, we have two types of treatments called thrombolysis and mechanical thrombectomy. And thrombolysis we can do within 4.5 hours of the onset of the symptoms. If you go to the nearby hospital where we can give injections like alteplase or tenectase, where we can break the blocks within the blood vessels, and 70% of the patients will improve. On between the window period of 6 to 12 hours, we can give mechanical thrombectomy in higher centers. Then after, if the patient comes to after 12 hours, then routine treatment for antiplatelets, statins, antihypertensives, diabetes. So these are the routine treatment for stroke. But prevention is better than, always better than cure. So stop smoking, stop taking alcohol, control your blood sugars, hypertension, reduce your stress, daily routine walking, and taking balanced diet, we can prevent the brain stroke to a larger extent. So these are the things that I want to share with you regarding the brain stroke.